My name's Denise MacLeod. I'm a pediatric nurse practitioner at the Cheyenne Children's Clinic. I've been there about 2 years now. For wraparound program, in my opinion, is it helps families that have kids with mental health issues or a lot of behavior concerns have that added support in the community, and that could be respite care, it could be connected to other community resources, how to get to appointments, how to just manage day-to-day life. I have a couple kids that are in the wraparound program. They have autism as well as some other mental health diagnoses. For the families, it has been one family, it was helpful. They were newer to Cheyenne. So just how do they access those resources, how to navigate the school system, how to get that respite care because they didn't have a lot of family support in town. The other one has a little bit older kids, and so dealing with, again, the school district as you're going into junior high, high school, as well as starting to look at what does that mean for being an adult. And some of those things of those behavior concerns when the kid's bigger than the parent. And how do you handle that, and what resources do you have? And those resources in the community keep changing, and so that makes it harder for parents to navigate as well. My experience with the wraparound program has been very positive. It's been very easy to refer. If I identify them, I talk to a case manager in our office who starts that referral process. And then there's Medicaid paperwork I need to fill out with their medical diagnoses to justify how they qualify for wraparound. And then that gets submitted. And from there, the family's already been contacted by wraparound, and they kind of take care of it from there. Some I've had somebody else from the outside has referred them. And in that case, they come in, we do the paperwork more to justify so they can get the services they need. When I'm talking to parents in the appointment, usually I explain what wraparound is to help them, and then recommend it to help them support them at home and support the family. For a provider that's never heard of the program, I would say that 1, it's easy to refer. 2, it's very helpful to your families that are dealing with a lot of mental health issues, behavior concerns, and it helps them in a variety of ways. So, and it's different than just referring like to a therapist or PT or OT. It's more the day-to-day challenges. I think the lasting impact of these programs is much more success for the family as a whole, because it impacts the whole family when there's these mental health issues or behavior concerns. For the individual child, I think because they have all that support and all those resources, their future's a lot brighter as far as can they function independently as an adult, or, can they have a job as an adult? Like we can reach their full potential as an adult. My favorite part of the wraparound, I think, is that program seems to understand how much those families struggle day to day and some of the challenges of day to day. And so they just feel that support and they don't feel judged in the process. High Fidelity Wraparound fills in the gaps for families.